Welcome to a presentation about laryngectomy brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Analogy is a great way to explain complex medical conditions. A laryngectomy is a surgical procedure that removes all or part of the larynx, which is also known as the voice box. To help you understand what this means, think of it like this. Your larynx is like a gatekeeper between your mouth and your lungs. It helps you breathe, speak, and swallow. When you have a laryngectomy, it's like removing the gatekeeper so that air can flow directly from your mouth to your lungs without passing through the larynx. This means that you won't be able to speak in the same way as before, but there are other ways to communicate, such as using an artificial voice device or writing. A laryngectomy is a surgical procedure to remove all or part of the larynx voice box. Symptoms of this condition may include difficulty speaking, difficulty swallowing, and a hoarse voice. Other symptoms may include coughing, shortness of breath, and a feeling of something stuck in the throat. In some cases, there may be a buildup of saliva or mucus in the throat that needs to be cleared regularly. Laryngectomy is a surgical procedure that removes all or part of the larynx, which is also known as the voice box. It is most commonly performed to treat cancer of the larynx, but can also be used to treat other conditions such as vocal cord paralysis or severe trauma. The demographics of laryngectomy vary depending on the underlying condition being treated. In general, it is more common in men than women, with a male-to-female ratio of approximately 3:1. It is also more common in older adults, with the highest incidence occurring in those over 65 years old. Additionally, it is more common in certain ethnic groups, such as African Americans and Hispanics. Finally, it is more common in smokers and those who have been exposed to secondhand smoke. Laryngectomy is a surgical procedure that involves the removal of the larynx or voice box. This procedure is usually done to treat cancer of the larynx or to remove other abnormal growths in the area. In some cases, it may be necessary to remove part or all of the larynx in order to prevent further spread of cancer. Other causes for a laryngectomy include trauma to the larynx, such as from an accident or injury, and certain types of infections that cannot be treated with antibiotics. Treatment for laryngectomy typically involves surgery to remove the larynx. This is usually done under general anesthesia and can take several hours. After the surgery, you will need to stay in the hospital for a few days for observation and recovery. In some cases, radiation therapy may be used instead of surgery. This involves using high-energy beams of radiation to destroy cancer cells in the larynx. Radiation therapy may also be used after surgery to reduce the risk of recurrence. After your laryngectomy, you will need to learn how to speak again using a special device called an electrolarynx or esophageal speech device. This device produces sound by vibrating air through your throat and mouth. You may also need speech therapy to help you learn how to use this device effectively. You will also need regular follow-up visits with your doctor after your laryngectomy, as well as regular checkups with an ear, nose, and throat specialist. Your doctor will monitor your progress and make sure that any complications are addressed quickly. The prognosis of laryngectomy depends on the stage of cancer and other factors. Generally, the prognosis is good if the cancer is caught early and treated promptly. In some cases, the cancer may not be curable, but it can be managed with treatments such as radiation therapy or chemotherapy. In most cases, patients who have had a laryngectomy can expect to live a normal life with few restrictions. They may need to use a speaking valve or an artificial larynx to communicate. They may also need to take special precautions when eating and drinking to avoid choking or aspiration. Overall, the prognosis for laryngectomy is good if the cancer is caught early and treated promptly, with proper care and follow-up. Most patients can expect to lead a normal life after surgery. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.